So what was the outcome and difference for us as a practice, us as the GPs, etc.? We've reduced our numbers of acutes dramatically. I have several audits showing what the acutes were like way before pharmacy team came into the practice. I've got audits showing what the numbers were like once the pharmacy team were first in place, and I have the numbers now to show that all of this work has greatly reduced how many acutes are coming through to the team. Click, please. The repeats are much higher percentage of all of our scripts than they used to be, and with that, because the acutes have gone down, the pharmacy team have more time to be doing better reviews of the repeat medications. We've also changed things slightly with our chronic disease patients of how the medications are reviewed there, and that's been tightened up. The patients that don't fall into that, the pharmacy team tell me that they have lists of certain patients that they worry about more. So your patients on a gabapentinoid and a step 2, and they keep an eye on that list to make sure. So that works for us as well. And as I said, we put some of these repeats on permissible numbers. Click, please. This has given the pharmacy team more time to do other things that I got told at the beginning that they wanted to do. So they now do the med reviews, as I've said. They do all of the med rec that comes through the practice. They have phone out appointments each week for patients that they can choose to put in there for whatever reason they want to. But it also means that the staff have got the ability to put patients into phone appointments with them as well. And if and when it's safe, or if they want to, they have the ability to have face-to-face appointments as well. Click, please. I think what's come out of this is that there is more communication between the pharmacy team and the GPs. And with that, I would say that there's a great improvement in the relationship and the mutual respect. So I now know if my pharmacy team is messaging me about a medication, it's because they really don't quite know, how to answer that by themselves. Whereas before, or sometimes if somebody is unused to our practice, we may get questions through that I'm like, but what do you think to do? Whereas I know what to expect from my team, and my team know what to expect from us. So I think that's really helped us. Click, please. I think the patients have a more streamlined access to the medications as well. It probably is a faster service than it was before. As I said, the staff know that they can discuss with the pharmacy team rather than having to wait to try and get into us. So they're probably more available because they're in a neighbouring room to them as well. Click, please. As I said, the staff have that option, but they also have the option of booking an appointment with the pharmacy team if it's a question about medication that the patient has. So the staff have more options of places to give contact to the patients. Click, please. And then for the MDT, I think that's improved the functioning within the practice with the MDT, and that just improves for the whole PCIP. It's improved everything for us here in the practice because everybody's working to their own specific role, but we're communicating better with it.